My name is Mackenzie Wilson, and the topic that I chose was wellness checks on the mentally ill. So a wellness check is a routine check that may be court-ordered or requested by an individual's family for someone living alone in an old age or with any mental deficit. This first came about in 2002 with the Mental Health Act. This essentially gave police the responsibility of overseeing mental health care users in the community. This is because mental institutions released long-term care patients in order to free up more space in hospitals and institutions so that they could treat more immediate critical cases. This was also a purpose to reconnect these individuals with society and regain relationships with the community as well as their families. And in turn, they also thought this might help the mental illness in these individuals. However, the families in some cases were not equipped to handle them and instead relied on police to make sure that the medical healthcare users were in good condition. The problem with this is that police inherently speak the language of crime and criminals, so they're used to dealing with people who purposefully offend instead of people who cannot necessarily control their actions because of their illness. So in turn, people were being criminalized for being mentally ill. And this is mainly because of a lack of training by police in mental health care. Some things that are associated with these wellness checks are the mental health triage teams and the mobile crisis intervention teams. These are specially trained mental health care professionals that work with the police on scene when these mental health calls come in. Not only do they work on scene, but they can also assist them from nearby control rooms. So they can guide the police through the call and help them relocate these individuals somewhere other than prisons or jails, where they'll get really improper treatment. They may not get the right medications. And then this also helps police to feel more confident and comfortable in handling these calls by themselves. And the studies have shown that this does help police confidence and comfortableness with dealing with these situations. Another thing that can impact these calls is the health of the officer. So the occupational stress and unhealthy coping mechanisms can blur the officer's judgment. It is shown that officers have some of the unhealthiest coping mechanisms when it comes to their occupational stress. Because despite of the responsibility on their shoulders, the possible mental and physical trauma that they are exposed to day in and day out, they rarely seek counseling and resources to help release this stress unless they are ordered to. So this can also make the officer's judgment and ability to correctly, safely control a situation harder, especially when dealing with a mentally ill person. A possible solution to this would be specialized response teams of medically trained professionals that specialize in mental health that remain on call to de-escalate these situations in the community and perform these wellness checks where the expertise would be needed. It would be my advice to keep the criminal justice and mental health systems completely separate because there is very limited research on the incorporation of the two. And these specialized teams' main role would be to respond to the calls involving the mentally ill and to administer possible treatment, medication, and relocation if needed. Since the police are specifically geared to focus on calls and on criminals, then it's hard for them sometimes to decipher and to administer the right treatment and the right relocation for these individuals that cannot necessarily control their actions.